Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spill, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Deborah and I are so excited and so grateful to be talking with Dr. Cindy Rima today. She's an adult nurse practitioner and has been a university nursing faculty for over a dozen years. Her experience spans from the bedside as an undergrad associate degree nurse through the journey many nurses have taken, including you probably, or are currently on, of juggling clinical work, family, life, while pursuing further education and culminating in her Doctor of Nursing practice degree in lifestyle therapeutics or lifestyle medicine. As a professor teaching across the undergrad through doctoral programs, contributing to the educational and professional growth of others can be tremendously rewarding, and we're super excited to hear about that today. Earlier in her journey, while living and working in the DC metro area for over 20 years, Northern Virginia and Maryland, she completed her MSN in primary care adult nurse practitioner degree through George Mason University, which at the time collaborated with George Washington University's School of Medicine. For several core classes were comprised of med students, nurse practitioners, physician assistant students, and others. And that rich experience really contributed to her perspective that considers patients first and how that will help us better synergistically align as we assess, diagnose, plan, implement, and evaluate the various healthcare challenges we as a nation encounter today. As the first nurse invited to join the prestigious Ardmore Institute of Health's Board of Trustees, Dr. Rima is honored to serve with this esteemed group as they work for a future where healthy lifestyles will be the preferred method to prevent, treat, and reverse chronic diseases such as diabetes and obesity. Like I said, we are so happy that you're with us today, and I'm very excited about this conversation. I met you one time pre-COVID, live and in person. And I just remember you being so vibrant and passionate. And I thought, wow, I want to tap into a little bit of what she has. So thank you so much for being with us today.
When you encounter that ACLM tribe, is that not just the radiance that exudes from this just glorious group of people?
Absolutely.
An honor. And Deborah, it's so good to see you again as well. It is such an honor and pleasure to be here with you all today. Thanks for hanging in there through the technology challenges and connecting. But
Mhm.
yes.
And likewise, too, I remember when we were together in Indianapolis and we were at the the first nurses gathering there. And I'm trying to think where else we met. I think it was probably there that we very first met. And I said, wow, you are in a school where lifestyle medicine is taught in the nursing school.
It
And
is.
tell me more about that. That's beautiful. So,
So
Right.
let's dive into that side for just a second because Southern Adventist University, it was my alma mater for my associate degree back 1,000 years ago. But they have, when they were looking at and considering starting a doctoral program, the current dean, Dr. Holly Gadd, it was her vision to have it be with lifestyle. And so they developed the first lifestyle nursing. So the lifestyle DNP program in the nation, and I think possibly in the world, but definitely in the nation. I think just recently a couple of other institutions may be looking at developing their own, but it has stood as the only lonely but courageous and trendsetter, as well as just with great foresight. So, as at that time, I was a faculty on the staff there, and as we're in the meetings, getting together, and the committee meetings, planning, and all the rest, and they're describing some of the classes and what the content will be. And at the time, I was MSN, and so would not be teaching doctoral classes. But they were talking about there's epigenetics in the environment. And they're going through all the elements in which you have that interplay, which is everything between lifestyle, our patients, and ourselves. And so as they were looking at this entire picture and talking about the class, I'm like, can I just audit? I'd love to sit in on these because it was such fantastic information. And then an announcement came out, excuse me, allergies. An announcement came out from our academic VP that if anyone wanted to pursue this doctoral program, that you didn't have to wait your place in line for the timing. And so I raised my hand quickly, and it was an honor and a privilege. It is a fantastic program looking at the various impacts and dynamics of lifestyle. And it was through that and with Dr. Lila Tryon that I was introduced to ACLM and had the great privilege of meeting Deborah and then you, Susie, and so many others. And one of the vibrant elements of ACLM the first time in going, and that was when Dan Buettner was one of the keynote presenters, and Dr. David Katz was the incoming president, and all these things. Um, the when was the last time that you were in a conference or a room other than ACLM in which it was a plethora of healthcare professionals and community and a wide expanse and cross section of the population that were as if it was one heartbeat, that there was pure, honest respect, collaboration, a presence for being there, both for the communities we serve, as well as then being able to also have the side benefit in one's personal journey, as well as with those we serve. And so that was the introduction to the lifestyle ACLM conference and to the broader tribe beyond our doctoral program and the wonderful individuals and experts that we had met through that coursework. And so that is the essence and heart of really what is core to my passion, to my mission. And I think for each one of us, our journey here is not about us. It really is. We have the honor and privilege of making our choices and finding our way on that path. But the folks we walk with on the journey, those that come and ask, those that we are close to that are in need, our patients, our communities, all the rest. That's why I'm here. And that's what lifestyle medicine can bring.
So well said.
beautiful.
So well said. Well, you already told us a lot about how you discovered lifestyle medicine and how you even came across this. Can you tell us about your role right now, what you're doing right now?
That's somewhat of an eclectic and loaded question because as looking at it in the questions, I'm like four roles right now. And so just in the essence of time, wanting to then focus in just briefly touch on four different roles. We had mentioned about the professor and teaching aspects. And so what an honor and privilege to have a part in growing the next generation and those who are the up and coming, whether it be in the undergrad, associate baccalaureate, whether it be at the advanced practice level or doctoral, to be able to have a role in their education is quite an honor and also quite a responsibility. And so there are a few things on that. One is the intentionality of approach. The phrase we mentioned, I think, before the recording started is historically education has been approached from the sage on the stage format. I call it death by PowerPoints, okay, versus having it be more engaged. And there certainly is a core of knowledge that the individual needs to have. And so there certainly is part of it is the content sharing, but it necessarily requires for success the student to show up wanting to learn. That's always good. As well as then there is no way on God's green earth to be able to impart to you everything you need to know in this classroom time we have together. Therefore, that active engagement in preparation before class, asking questions, being insightful. And if you don't know, it's great to ask. In our journey of knowledge, there's always a point at which we don't know. And so embracing imperfection. And if you're not familiar with Brene Brown, let me put this plug right here, life changing, and definitely want to look up those TED Talks and pursue her writings. But to be willing to show up to life and class right now, engage in that learning, and then be able to have that become part of that gold that we're able to then share with the patients we serve. Challenge. So in listening again to going back to the Future of Nursing 2030 and listening to some of those presentations, it once again gives that sobering element of the crisis we face in the shortage of nursing. The auto connect of YouTube then traced on to where there was, another poster talking about how every year there are near 100,000 capable applicants turned away from nursing programs because of a lack of teachers, resources, clinical sites, all the aspects that impact. And therefore, we're losing the opportunity to have capable individuals joining our ranks. That is a ripple effect. In 10 years, you've got 1 million people, right, that have just been turned away. However, as professors, the pay scale is, in some cases, depending on the market, 50% of what one can make clinically, and the clinical rate is appropriate and in the low end of the medical professional pay scale. We talked about the different roles. One of the aspects that we need to keep in mind and encourage and find ways to find solutions is how can we make that more equitable so that we do have the capability of training the next generation and have a capability of bringing in talent and we're losing too many resources. So being able to encompass more, that alone needing to be able to bring in individuals who are capable as the up and coming nurses. But also then that helps to sustain the longevity of the professors in play if they are able to earn closer to market wage as a professor, instead of, as has so often been the case with the vast majority of us, juggling multiple roles to try to help make home budget with also doing clinical work. I embrace that aspect also for being current clinically, but there's only one of the person. And if we were able to find a more equitable pay scale, both for those teaching, but also then being able to embrace that being across the board for our bedside nurses. And thankfully, it's much better now for our advanced practice, but again, continuing to support that aspect. The 4 roles and time. So we may not get through many of your questions on the list, but let's do what we can. Then from that, the professional, individual, the collaboration there, again, thankfully, pay scales are improving, but that needs to support as well. And then also supporting individuals practicing to their full potential for the benefit of our patients. Okay. Now, what does that incorporate? And so we had a congressman come to one of our DNP seminars. We do that each summer. And we were having discussions on full practice authority here in Tennessee, is where I'm currently living, DC metro area previous, and having honest discussions about, so what's the holdup? And we were looking at Tennessee at the time, but we also need to look at that national level. And his concern was that the clinical hours in the program for the nurse practitioner tracks were not, he did not feel on par with the 2,000 hours or 5,000 hours that the med students were required at the time. We had the discussion of, yes, but with our nursing program, your work experience of 2,000 hours is needed before you even get your foot in the door to begin the program to become a nurse practitioner. And so a foundation is being built on that nursing experience. That gut clinical expertise of bedside is the foundation. You have the education, you have the experience that's going on for thousands and thousands of hours. that is the foundation on which then the advanced practice and the doctoral is then built. So I talk to my students about your house of knowledge. You need to build that foundation strong, and each layer in that foundation as you build your house needs to be solid, absolutely solid and strong, so that your house then is fully supported. And so, as we're going through, then having an honest discussion about what are the concerns? Is it clinical experience? Let's take a look at really what's happening and going on. Us as a profession with the new essentials, embracing that evidence-based, competency demonstrated elements of graduating. These are the requirements necessary to actually say that you have this degree and to actually have that be evidence-based. The other part is that collaboration for all of us. There is not a single individual who knows everything. And so it is on each one of us to own what we know and what we don't, to have the humility and professional responsibility to network and ensure that our patients' needs are being addressed. And that means wonderful, robust collaboration across the spectrum. I embrace collaboration. I think we are all better. Our patients, absolutely, but also us. If we look at this as a journey together, stop the infighting. Let's be here for the patients. Seriously. So,
Again, so well said. I love it. I love it. So one of the questions that popped into my mind, because we're talking about lifestyle medicine, lifestyle nursing, do you feel like incorporating these lifestyle principles could be a draw for people looking to go to nursing school? Do you think that, or do you think it's just so much focus on the fundamentals that I think we need to probably bring more lifestyle into? But what are your thoughts about that? And how does your school, which was the leader, do
kind of
that?
a loaded question, but here we
Right.
go. So let's look at this a few different ways. One, absolutely yes, can be. Is it currently? We've actually had applicants come, and you can speak to this for any school in the country. We have several. We've been working at both the undergrad and graduate level through Ardmore, through ACLM, and with the nursing community networking to encourage and coax and cajole and build solutions. And Kelly Freeman with ACLM building the Lifestyle 101 tool to be able to have it so that you can have a plug and play or take out, be able to use elements, but have a springboard to where it helps to bridge across that initial inertia. Okay, that we want to be able to look at problem solving, identify barriers of building this into programs, and then what can we do to find solutions to any of those barriers or concerns. The undergrad programs with NCLEX and the looming element, and you live or die based on your NCLEX pass rates. Okay. And so with this, if it's not being tested, it's typically not being taught. So how much do we as nurses value lifestyle medicine and our patients' health? Because the evidence shows that lifestyle medicine is the strongest medication out there. Okay. Not it helps. Sure, it helps. But we're talking about some of the most impactful interventions that exist. Okay. So if we look at this as putting our patients first, and then what can we do to bridge forward for the best good of our patients? Incorporating lifestyle into undergrad programs, having it be part of the discussion, having it be part of the content, being able to then have that at the bedside along with our broad healthcare team so that all of us are able to embrace the evidence versus just work on historic data and support our patients in their journey. In the advanced practice programs, there is far more willingness to embrace because one, there are a few electives, two, the full track exists, and then there are individuals absolutely seeking it. So we've had applicants come in looking specifically at our undergrad program because we have lifestyle in the doctoral, and then wondering why in that AS prep, or if they're doing the BSN program, why there's not more rich data on lifestyle. And it's because the content based on the current NCLEX requirements, they are pushed to try to even get that content in, let alone talk about even 3 minutes of lifestyle content. And the students tend to feel pretty overwhelmed because it is very content dense, content rich, opportunity for learning rich to embrace all of this. But I think it is crucial to us being able to take the best care of our patients and, quite frankly, ourselves. Just a brief side reminder, our nursing code of ethics, if it's been a while since you read it, and it had been for me, was self-care is part of our ethical code. I missed that one for way too many years as we, as nurturers and carers of our family and all the rest, care for everyone else. It is our responsibility to put ourselves on the list as well of those we care for. So from my nursing heart to your nursing heart and to all of those that we serve, put yourself on that list of those you care for. Make it intentional.
Yes, that is in the code. It's also a call to action of the Future of Nursing report. It's one
It
of
needs to be
the
a call for action because a lot of us had missed it. We'd gotten to number 5 or 6 on the code of ethics and doing our best effort to get all of that. And self-care is the thing that tends to drop off of the radar.
yes, absolutely. And I know Deborah probably is wanting to say something about either the code or the scope of practice. I'm curious. So I'll turn it over to her for a minute, then we can come back. Yeah, go ahead.
Go ahead, Susie. Yeah, follow your thought.
No, so what my thought was, I'm curious as to what are the essential elements or relationships that you have found even in your local community, whether that's the dean of the nursing school, who are the stakeholders and what relationships have you had to forge to be able to drive this mission?
I am blessed that others are the pioneers. I'm not the spearhead. I benefit from and have been a part of. So for our institution, Southern Adventist University in Collegedale, Tennessee, in the Chattanooga, Tennessee metro region. And for those of you not familiar with, because it's Southeast and a lot of people are, where's that? Take Nashville, Atlanta, Knoxville, bring all those together. It's Chattanooga. Okay. So with this, geographic region is only important as so far as we're in the South and the risk here, diabetes, obesity, you have the list of line up all the chronic diseases and you've identified opportunity here. Initial, if a program is looking to incorporate this in, it would be the higher ed nursing faculty being able to persuade their academic team that this would be worth their time. One other possibility is to have a DNP program that has the option of and an emphasis in and be able to build classes that fully support that. Or you can certainly come here because they have an excellent program and it's fully online. But the question of barriers then as we're going through, there are probably many beyond the scope of this interview potentially, but things that can help to support it. And something that was on my wish list, I haven't been able to get it done, is to also have where there is a clinic outpatient center of some type in which near the institution, which many of them, Harvard, New York, many of them have this associated with their programs, especially if they have a med school with their institution. But having a clinical site that is then directly affiliated with gives the opportunity for both the students in their learning process, but also for your faculty who want to stay clinically engaged to be able to have options as well. So that can be one aspect. And that on the list of things needed, this is not at the top. Okay. This is me dreaming and letting what I'd wanted to do around here, as Dean Holligan, Dr. Holligan had wanted to do years before. So from the higher ed aspect, that's one part. In the clinical realm itself, thankfully, there are more lifestyle strong clinics and healthcare resources coming into existence. There are various models. And again, the question is reimbursement. Will the insurance company pay for the interventions of lifestyle? And if they're not, it's hard to be able to grow a business if the service that you're providing is not reimbursed for. And so the aspects of being able to have effective, appropriate reimbursal for service be part of this necessary discussion of barriers is one of the pivotal aspects. ACLM has as a group, as well as Ardmore Institute of Health. Our president and CEO, Dr. Ron Stout, is networking. I swear he's got to have like triple clones in a closet somewhere because the man just goes. But he is fantastic in networking across organizations and all the rest to be able to bring awareness to. And he's one individual in the AIH grouping, as well as a few other physicians and wonderful individuals. But networking out, getting the awareness of being able to grow the engagement and pursuit of learning about lifestyle. And once you learn that it is the most effective medicine out there, to be able to bring on board others in our healthcare professional team and be able to get us all, again, working for the good of the patient, then that helps to bridge through some of the barriers. Not all, some.
And there are plenty of barriers, but there's a lot of wins that have happened too, right?
And any barrier is simply an opportunity for a solution. Okay. When I talk to my students and they're freaking out at the beginning of the semester about tests, I'm like, think of tests as you've got in your mind all of these barriers standing up, like you've got to scale this wall and get over it. What I'd like you to do instead is I want you to push those barriers and make them flat. And now they are stepping stones. Any barrier that we encounter is simply a stepping stone to be able to go towards solution. And if
Love that.
Oh man, if each one of us, healthcare team, community individuals, community leaders, if we can each put what is best for the patient forward, be able to then bring that forward. What's best for the patient? That they have healthcare professionals that can get paid enough to be present to work for them. What's best for the patient? That we provide these institutions and these clinics and these communities. What's best for the patient? That we have the education, the individuals and the experts to educate this next generation so that we can get more healthcare professionals in all the various fields out there to do the work needed. That's how I shifted.
I love that. I love it. And so, Deborah, I'll turn it over to you. So go
Thank
ahead.
Thank you, Susie. Thank you so much, Dr. Rima. We could talk all day about all of these things. I was taking a few notes as you were sharing a couple of things if we can go through and just see if we can check some of these and get your input on these. The DNP, the amazing groundbreaking DNP program there at SAU. Do you see that lifestyle medicine lens filtering down to the bachelor's level, including possibly in those courses that we all remember from the bachelor's level, where it was the sensitivities about different communities, cultural sensitivities, and how that could be parlayed into the things about social determinants of health and environmental determinants of health. Anything that you see there as different at SAU in the bachelor's, not that it's beyond it being an excellent program overall, so informed by this progressive lens, but also how some of that content may be filtering down.
And to take it beyond the borders of SAU as well. So with this, any program that has electives as part of their program in the bachelor degree track, then that's where we're finding effective incorporation. There's one, Optimizing the Brain, based on Dr. Neil Nedley's work on the impact of so many things on minimizing the risk of depression and lifestyle ways to approach it, that one of our professors, Becky Redster, took that content, developed into an elective. There are other electives as well. That can be one aspect as well, but also in the populations and community, essentially your community health aspects, being able to have the awareness of the cultural aspects. I find that it is most effective if we approach, again, the Brene Brown echoes here of, if we start with the base presumption that everyone is doing their best, okay, no matter where they are, that they're doing their best, and that what we see as the concerns, the barriers, the challenges. If we start from the perspective that they're doing their best, it helps us to be more compassionate in how we approach concerns, right? So then the teaching aspect, being able to bring lifestyle into the discussions we have, from a practicing NP at a different clinic. This was with one of the other clinics in the region. I had this lady and we're talking about the importance of the nutrition and all the aspects and the fresh produce and all of the things that can help in building one's more optimal health. In exploring the why behind it not being as robustly incorporated, found out that she takes public transportation from the grocery. She has 2 connections to make. She has to physically hand carry all of the bags of groceries for whatever's going to make it home. If one of those bags tears, all the rest, she's got to get on and off of buses, stand and wait in the rain if that's what's going on. So when that's the case, and we're asking her to carry 50 pounds of groceries, including the apples rolling out of the bag splits, it helps to give us a far better realistic perspective of what the individuals are dealing with. So, can we find other solutions that can help? Possibly even networking with Lyft or Uber in the area, cut some of the community aspects, whether there's an option to be able to have a volunteer driven transport that would be willing to help people make it to the grocery and back, whatever the aspects are. The other is, can they go in and purchase fresh produce with their WIC? In the past, it was very limited or non-existent, or the price was so much that they're looking at, I can get 3 of the 2-liter Mountain Dew that my kid wants or that I want versus 3 apples. What's gonna win out here? And look at the full perspective. So bringing that also then back into our educational process, okay? Real life examples to help our students see some of the barriers and challenges so that, as in the Future of Nursing 2030, when Dr. Kenya Beard was speaking about, whenever you see someone, do you really see them, right? When you have the individual sit down, and for her, African American, sitting there, and no matter what she was doing, she came in and lifestyle and blood sugar were still elevated. Are we truly willing to pause, meet the patient where they are, ask them what's going on, look at the not just the risk factors, the environment, the whatever is going on with the individual, and finding effective solutions, and leave any criticism outside and not even have it as being a part of your role at all. If we approach with the presumption they're doing their best, there's no room for criticism. We're just helping people identify and find solutions, and then embracing for the journey.
Thank you so much. So beautifully said. With these idealistic nurses that are coming into bachelor's level classes, and it's wonderful to hear how these can be infused into even that very packed schedule for our nurses that are still testing in an NCLEX. It really